Hi dear doctors, welcome to Pediatrics class. This is Kids Covery and I'm your faculty, Dr. Parv Luthra. Let's quickly start with the horseshoe kidney. Okay, so you must have seen the horseshoe shape. Okay, and if the kidneys will assume that shape, can you see? This is the normal system of the kidney. This. And this is something that is the abnormal system of the kidney. Okay, this is called as horseshoe shaped kidney. So let me just show you some specimens. So can you see this is the abdominal aorta, this is IVC, and they are posterior to abdominal aorta and IVC. So this is a posterior horseshoe shaped kidney. Whereas if you see this is a anterior horseshoe shaped kidney, and the thing which you are seeing in the middle, this one, this is called as isthmus. This is called as what? This is called as isthmus. Okay. So horseshoe kidney is actually a midline fusion of the lower poles of both the kidney. Okay, so it's a midline fusion of the lower poles. Okay, so which pole is involved? This is the lower pole which is involved. Okay, lower poles of both the kidney. Now you have got something which is called as embryological abnormality. So what is the embryological abnormality? That the inferior poles of the developing metanephric kidneys, understand this, the inferior poles of the developing metanephric kidneys fuse in the midline during the ascent. Are you getting this? The inferior poles of developing metanephric kidneys are going to fuse in the midline during the ascent. So the inferior poles are going to get fused during the ascent. And what happens? That during the ascent, the fused kidney gets trapped behind the inferior mesenteric artery at L3 vertebral level, preventing the normal upward migration. So let me just try and show you. Yes, can you see this inferior mesenteric artery? So this is your abdominal aorta. Actually, this is the posterior view. So what happens is that, at L3 level, so the inferior mesenteric artery is going to come like this. Okay, inferior mesenteric artery. Okay, I'm trying to show you. The inferior mesenteric artery is going to come like this, and that's going to prevent the upward ascent of what? Upward ascent of the kidney at which vertebral level? At L3 vertebral level. So now, because it is not ascending, the kidney is going to remain low in the abdomen. Okay, because it is trapped under the inferior mesenteric artery. Now, the other thing which happens is that the ureters will be compressed by the renal isthmus. Okay, the renal isthmus is going to compress the ureters. Okay, so this renal isthmus can sometimes compress the ureters also. Okay, so the ureters which are coming, it can be compressed with the help of due to this isthmus, although not very much evident in the pictures which I have shown you. But yes, they can be compressed, leading to what? Leading to urinary tract obstruction and urinary stasis. So because of the stasis of the urine, okay, the bacteria are going to overgrow, and that leads to what? That leads to increased incidence of urinary tract infection. Sometimes stones might also develop, and that causes nephrolithiasis. Okay, and there is associated risk of Wilms tumor also. So there can be nephrolithiasis, Wilms tumor, UTIs, all these things can be occurring. Now this is a very important MCQ that has been asked multiple times, that which is the syndrome which is associated with horseshoe kidney, and this syndrome is nothing else but the Turner's syndrome. Which syndrome is associated? Turner syndrome is associated with the horseshoe shaped kidney. So this is all about the horseshoe shaped kidney, and I hope I was able to do justice to this topic. I know this is a very small topic, but we should be able to write when it comes as a short note also. So that's why I've given you all the required details. God bless you, and we'll see you in the next class.